My name is Dr. Peter Szeibel. I am a psychiatrist working with Athens Neighborhood Health Center. I'm board certified in general psychiatry and have been working as a clinical psychiatrist for over 35 years. Welcome to our mental health segment of the presentations. During this talk, I will present 10 statements about antidepressants. After hearing each statement, you should try to decide whether the statement is true or false, whether it's a fact or a myth. Then after each statement, I will proceed to give you the correct response and explain the reasons. So here we go. Statement number 1. Antidepressants are habit-forming and can increase the risk of future substance abuse. The answer is that this is a myth. This is false. If anything, antidepressants can decrease the risk of substance abuse, especially if the substance abuse is a form of or an attempt to self-medicate depression, as with alcohol or drugs. Antidepressants are not habit-forming, and the reason for that is because they take so long to start working. When you think about it, things that are addicting are substances that get into your system quickly, such as alcohol, opiate pain relievers, or anti-anxiety medications such as benzodiazepines. These medications go into your system fast and they go out of your system fast. So there is a high potential for addiction in this group of substances. However, with antidepressants, it can take several weeks before one notices any benefits from the medication. And there's certainly no cognitive changes that occur immediately or mood-enhancing effects that occur immediately. So antidepressants are therefore not habit-forming at all. They're not addicting. Statement number 2. Suddenly stopping antidepressants often causes withdrawal symptoms. Generally, this is not true. And the reason, again, is because antidepressants have fairly long half-lives, which means that they stay in the system for a long time after you quit taking it. Now, there are some antidepressants that have short half-lives where there can be withdrawal symptoms. But out of the 24 antidepressants that are out on the market, I think there are only 3 or 4 that can cause withdrawal symptoms. And those medications are Paxil or paroxetine, Cymbalta or duloxetine, Effexor or venlafaxine, and then a drug which is basically a variation of Effexor called Pristiq, which is desvenlafaxine. These 4 antidepressants have the shortest half-lives, so there is some risk of withdrawal symptoms when a high dose is stopped immediately. But most of the other antidepressants have much longer half-lives and do not go out of the system that fast. For example, Prozac has a half-life of 6 days, which means that even after you quit taking it, it takes 6 days for your levels to drop to 50%. So Prozac has its own built-in tapering mechanism. There's no such thing as withdrawal from Prozac. And in general, most of the antidepressants do not cause withdrawal symptoms when they're stopped suddenly. Statement number 3. Benefits of antidepressants sometimes do not appear until 4 to 6 weeks of treatment. This is true. It can take a long time for antidepressants to exert their effects. This is even more so in elderly populations, where it can take up to 6 weeks for antidepressants to work. So again, we already answered this question when we talked about the risk of addiction. Antidepressants don't have that risk because they take so long to work. Statement number 4. In certain populations, antidepressants may increase the risk of suicidal thinking. Actually, this is true, and in particular, the population I'm going to discuss briefly are adolescents. There are black box warnings for antidepressants in the adolescent group because antidepressants can sometimes increase the risk of suicidal thinking in adolescents, especially early on in the treatment. Statement number 5. It is unsafe to drive or operate machinery while taking antidepressants. This is a myth. It's not true. Almost all of the antidepressants do not cause any slowed motor responses or slowed cognitive functioning. They simply do not have that kind of dulling effect. There are some antidepressants, however, that can make you sleepy, and those are ones that are usually prescribed at bedtime, such as Remeron or mirtazapine. But in general, almost all of the antidepressants are safe to use when you're driving or operating machinery. Statement number 6. Most people develop tolerance to antidepressants and therefore need to keep increasing their dose over time. This is a myth. People do not develop tolerance to antidepressants the way they can develop tolerance to opiates or benzodiazepines. Now, sometimes the disease course of a clinical depression can worsen. For example, if you're being treated for depression and then some tragedy occurs where a loved one dies in an accident or something, yes, the course of the depression may worsen, in which case you may need to increase the dose. Or if another medication is added, which sometimes may interact with your antidepressant and lower your levels of the antidepressant, then a dosage increase might be needed. But not because people develop tolerance. Statement number 7. The side effects of antidepressants make a person more conspicuous and noticeable in a group of people. In other words, the person stands out. This is a myth. This is false. There's no way that I would be able to tell, looking at a group of people, which ones are on antidepressants. Now, there's another group of psychiatric medications that are not antidepressants. They're called antipsychotics, and those can cause what we call movement disorders, such as tardive dyskinesia, and those people can stand out in a group. But that's not with antidepressants. Antidepressants do not make a person more noticeable. Statement number 8. Combining 2 or more antidepressants will typically cause additive side effects or cumulative side effects. This is false. Actually, it can be the other way around. Sometimes 2 antidepressants cause fewer side effects than 1 antidepressant. How can that be? Well, they may have opposite side effects which cancel each other out. For example, antidepressant number 1 increases appetite, antidepressant number 2 decreases appetite. So the 2 antidepressants together cancel out each other's side effects. Another example is sedation. One antidepressant makes you sleepy, another one makes you more alert and stimulates you, so they cancel each other out. And good psychiatrists who are pharmacologists will make use of this when they pick and choose which antidepressants a patient should go on. Sometimes to manage side effects, instead of lowering the dose of an antidepressant, we will add a second one to cancel out the effects, the side effects of the first one. So we use this to advantage. Statement number 9. Antidepressants have been known to cause permanent side effects. In other words, effects which can persist even after the medication is stopped. This is not true with one exception. There's a medication, Paxil or paroxetine, which if taken during pregnancy can cause congenital birth defects. And of course those would be irreversible in the fetus or the baby, but not in the mother. So actually antidepressants will never cause permanent side effects in the person who's taking them. But with Paxil, it can cause permanent side effects in the offspring. And finally, statement number 10, antidepressants can sometimes decrease anxiety and can sometimes increase anxiety depending on the medication and the patient. Actually, this is true. Antidepressants are complex medications that have multiple effects on receptor sites at the synapse, both presynaptically and postsynaptically. There are multiple receptors, and sometimes antidepressants can worsen anxiety, and it's a side effect of antidepressants, and sometimes they can treat anxiety. So it depends on the medication, the dosage, and the patient. So that brings us to the conclusion of this video presentation. I thank you for listening.